So right now I'm driving, so this is pre-recorded. We're going to talk about assisted oral hygiene. We're going to talk about lots of different tools, tips, and tricks to improve oral hygiene. Then we're going to talk about guided oral hygiene, which is like assisted oral hygiene but using teledentistry. And we're going to finish up talking about a documentation system that promotes independence called the Your Special Smiles Oral Hygiene Ability Spectrum. We're going to go through it quickly. We got a lot of information to cover in 30 minutes, so here it goes. So first, assisted oral hygiene. We noticed that in long-term care facilities and group homes, sometimes the caregivers would struggle to provide oral hygiene on a level that we wanted for our patients. So we placed a dental team member in the home regularly, 1 to 3 times a week, and that dental team member typically was an assistant, and they helped hands-on with that patient or resident to be able to complete their regular oral hygiene or daily oral hygiene tasks. In collaboration with Idaho State University, the Idaho Oral Health Program, and Dr. Paul Glassman, we came up with this definition of assisted oral hygiene, and here it is. It's physical assistance with oral hygiene procedures for individuals who are unable to adequately perform the recommended self-care oral hygiene regimen. Assisted oral hygiene is a specific service and may be delivered separately or as part of a remote oral health support program. There is no current CDT code to describe this service. Looking at assisted oral hygiene is a pretty simple workflow. First, the dentist is going to review the medical history of the patient and write any modifications that are needed. We have some patients who are at aspiration risk. As we know, not all patients are the same. Every one of our patients is very unique, and so the dentist is going to look through that medical history. The dentist is going to meet that patient and then write up any needed modifications. The next thing is we're going to gather data. We take photos of the teeth, we take videos of the teeth, we look at their dental charts, and we're going to take all of that information and work with the hygienist. The hygienist is then going to look and say, these are the areas where I anticipate problems, and these are the oral hygiene tools that I think would be necessary to overcome those problems. The hygienist is then going to develop a very specific dental hygiene plan for that patient, and we're going to work on that together. The hygienist will then train the oral hygiene assistant, and that oral hygiene assistant is going to go and perform assisted oral hygiene after being trained by the hygienist, using the tools that that hygienist has hand-selected for that resident. Of course, the person who is performing this is going to be under supervision at first. Through either the dentist or the hygienist is going to watch that person, and that supervision can be in person or through teledentistry depending on what state you're in. We've used both. Now let's look at some cool tools that we use to help the caregivers and to help the patients be more successful when performing home hygiene. Some of our patients can't reach their mouth, right? So we have these extenders. They're toothbrush extenders, and if a patient is like this, they can still brush their teeth with this extender. We also have some that you can see here that make it a little wider. And again, I don't have any financial interest in these products, but I have a lot of interest in these products because they do help us and they help our patients. These are neat because they're dishwasher safe. And here is the box so that you can see what the box is where you can find these. If you wanted what I like to call the poor man's version, you can take a terry cloth and a rubber band. Those things are pretty cheap, and you can just throw this in the laundry, and that also will extend it. You'll see a lot of things where you'll see a tennis ball, and the downside about using a tennis ball for something like that, you know, drilling a hole through it and then sticking a toothbrush in a tennis ball, is that a tennis ball has all that fuzzies, and all of those fuzzies provide a lot of surface area for bacteria to grow. Tennis balls are also super hard to clean. For those of you with dogs, you know that as you drool on a tennis ball, the tennis ball eventually gets gross. Well, if you're brushing your teeth using a tennis ball handle, that can eventually get gross as well. So my recommendation would be to look into maybe one of these or one of these if you wanted to widen that handle a little bit. These products help promote independence. I really like these products, and it's something that might be able to help you with some of our more independent patients. Another little home project you can do with a toothbrush to make it a little easier to hold is the little pedicure things that you use. You can make those be little finger holders. And so if the patient's not able to hold it, you can put it on their fingers and then they can brush their teeth. So another little home project that you can do to help your patients be a little more independent and perform their own oral hygiene. We see our 3-sided toothbrushes. So 3-sided toothbrushes brush all 3 sides of the tooth at the same time. And this one's called the Collis curve. You'll notice that this one would go on the tooth like this and brush the top and the sides all at the same time. So this is the Collis curved toothbrush, which is a little bit differently designed than the triple bristle brush. This is the triple bristle brush. Also brushes all three sides at the same time. The triple bristle can be electric, and I do believe they have an electric Collis curve out. But again, when you're instructing your patients to use these, we put it on and just like a roller coaster, go back and forth and brush the teeth. There's various other three-sided toothbrushes, such as the surround brush from the Specialized Care Company. It looks a lot like the triple bristle brush. And then we have this that I just bought off of Amazon. So if you look at three-sided toothbrushes, there's quite a few of them. And one good thing here is you can just splay that out to clean it out. When you're using a three-sided toothbrush, the most important thing is to get inside those little areas. You see those little triangular areas in there? I'm trying to show it to the camera here. There we go. You can imagine that food and gross stuff can get stuck in there, so make sure you're cleaning that out if you're using a three-sided toothbrush. Make sure that you're helping them get that cleaned out and that you're monitoring that so that it does get cleaned out, because the last thing we want to do is brush with a dirty brush. There's a lot of trend with this full arch toothbrush, and with the full arch toothbrush, if that is what you choose to use, then you don't just stick it in, push the button, and then magically all the teeth get cleaned. If you use a full arch toothbrush, the proper technique to do so is you put the toothbrush in your mouth and put it on the bottom teeth, pull forward, and brush the back of the bottom teeth. Do that quadrant. Then push backward. Do the front of the bottom teeth. Now you've brushed the bottom teeth. Go to the top, pull forward, do the back of the top teeth, push back, and do the front of the top teeth. And so, again, when you're looking at the full arch brushes, you want to make sure that you're not just sticking it in, pushing the button, and expecting it to do all the work for you. You still do need to brush the teeth utilizing these. Other things to look at when selecting a toothbrush is how does that toothbrush feel? A lot of our patients are hypersensitive to stimulus, right? And so if you have a toothbrush and they can feel all of those bristles and they just, don't like the feeling of the bristles, sometimes that's the biggest thing for us to overcome is the feeling of those bristles. We can look at different feelings of bristles. Things like the nano brush. The nano brush has a ton of bristles and it is very, very, very soft. I'll put it up here so you can see a little bit better there. It is a very, very soft brush. It works great for patients undergoing chemo with a lot of dry mouth. And on that same line of very soft toothbrush and very soft bristles, we also have the TPE Special Care Super Soft Toothbrush. And this toothbrush is so soft it feels like you're just brushing with a piece of silk. These are two real soft toothbrushes for people who do not like the sensation of the toothbrush bristles on their teeth. It feels very, very different. So those are two things that you can try. A bamboo toothbrush has a little bit of a different feel. You can get a toothbrush that is, and we still recommend soft or super soft, but you can get a bamboo toothbrush and that's going to have a little different bristle feel. For those of people who are really into environmental conscientiousness. Some patients will enjoy using these because it makes them feel like they're helping the environment by using something that is natural. It also has a different feel in your hand as you're holding that bamboo toothbrush. Maybe holding the toothbrush is something your patient doesn't like. We don't know why the patient doesn't want to brush, but sometimes it's the way that that toothbrush feels. And then again, you can go way off into looking at various different toothbrushes, and this is a goat hair toothbrush from Japan. I've never had a patient use it, but we do have it, and the bristles do definitely feel different. And so lots of different toothbrushes. Toothbrush selection is important. In our clinic, we're going to have a toothbrush petting zoo so that our patients can touch and feel the toothbrushes and decide which one would be best for them. Again, you might not choose the best toothbrush the first time you select it, so the willingness to adapt and adjust your technique, adapt and adjust your instruments until you find what works for that patient is so important for our very unique subset of patients. Something we hear from caregivers all the time is that they try to brush, but the patient or the resident just keeps biting down, and they can't get in and they can't clean those back teeth because they can't get them to open. So a few things that help people open. This is one of my personal favorites. It's actually made by a medical company. It's made by Medline, and this is a bite block. So you would have them bite on one side while you brush the other side again. The thing I like about this is that you can wash it, you can use it multiple times, obviously not on multiple patients. This is a one person only, it's not sterilizable. And so somebody would have this in their kit, not to be shared. And it's really chewy. Another thing I like about it is that it kind of tastes like a popsicle. So if you have a really good flavored mouthwash, like a mouthwash that they really like, you can dip this in the mouthwash. It tastes like a popsicle. They go to eat the popsicle, they chew on the popsicle, and you brush the other side of their teeth. So I really particularly like this product. Another product from the Specialized Care Company, this is the Molini mouth prop. Same thing, it's just a little harder. This is more used in a professional setting. It is autoclavable, it is sterilizable, but it's a little less soft for daily use. It's a little hard, but it's still excellent product. We have the open wide mouth prop. This is by the Specialized Care Company as well. So this looks like this. It is a styrofoam on the outside of a tongue depressor. Same exact idea. The only downside with this one is that it's more of a single-use product. Of course, you could use it a few times, but with styrofoam, you know, you want to be careful with how many times you use it for structural integrity and also cleanliness. But again, a great product, very comfortable, probably the most comfortable one, just maybe not the most financially economical because of the lack of being able to reuse it over and over and over and over. This, by the Specialized Care Company, is a bite block. If anyone is looking to use a bite block like you have at the dentist office, you know those little triangles that they put in your mouth. If you're wanting to use those, make sure that it does have a handle on it or that it's got floss tied to it. Patients can and will open a little wider and can try to swallow, or not try to swallow, but accidentally try to swallow some of those little triangles. So I always use the one that has a handle, and there's 3 different sizes of this. This one's the largest size. I usually use the smaller sizes, and that's why this one's in my demo. But these are nice as well. Caregivers talk about not being able to see. And when they can't see, then it's really hard to brush maybe like the tongue side of the lowers. So this is called the Mouth Mate. And here's a little container for the Mouth Mate. Oh, that's upside down. There we go. There's a container for the Mouth Mate. The Mouth Mate can be bent. And you go. It's a retractor, and so it'll help retract the tongue, retract the cheek so that the caregiver can see a little better. The patients can use this as well. Maybe the patient is using that special mouth rinse that changes the plaque different colors, and then you want the patient to look in their mouth and see everywhere that they missed. Let the patient use these. Now you want to be careful up here. I think these last about 3 months, but do check the manufacturer's instructions, because this right here can work harden a little bit, and this would be the weak point right there. So the Mouth Mate, another great product to be able to see inside the mouth as you're performing oral hygiene, or for the patients to be able to check their own work. So awesome. We've talked about brushing, we've talked about being able to keep the mouth open, but one thing we haven't really talked about is cleaning between the teeth, flossing. And so when you're having somebody floss, a caregiver will get very self-conscious if they're going to use string floss like this and go like that, because you're putting your finger between the teeth. Nobody wants to get bit. A lot of people report that as their biggest fear with providing oral hygiene from somebody else, is that they don't want to get bit. So what we do is we use flossers. I personally like these little flossers when I'm flossing somebody else's teeth. You can keep your hands outside of their mouth and still have pretty good control getting between the teeth. These are another alternative. So these you wrap floss around, go up, over, back, and wrap floss around here, and then you can floss like that. They're nice. The downside with these is that you have to wrap them tight or it's difficult to get it through the contact for somebody else, and people get a little nervous as they're going through that contact. So having too much give in this area makes that a little more difficult. The other problem that I find with these is this type of plastic is a very rigid and brittle plastic. When you're looking at a rigid, brittle plastic, you don't want to use a rigid, brittle plastic with a patient who might bite down on it, because a patient with a powerful bite could get out of that little bite stick, you know, and chomp down on that and break it. And we don't want to use anything that someone could bite and break. We've got some patients with like masseters of steel. And if they've got a masseter of steel, then I would recommend a softer, more flexible flosser, because they'll bite on it and you may have to try to wiggle it out, but it's not going to break. Another way, if you really don't feel comfortable flossing, or if they have larger gaps, is we have our interproximal cleaners. You've got a couple different types. These come in such small diameters that you can even put it in between the teeth that don't have a gap. You can see in my teeth here. And you can clean below that contact where the teeth come together, where you're trying to clean with the floss. So these, and you can do all of that from outside of the mouth. The fingers do not go between the teeth. You're not going to get bit. Same with these, a little bit bigger, and they go in bigger spaces. So those are some interproximal cleaning aids. We also love the water pick. The water pick is something that will blow some water in between the teeth, just like our little dentist tool when we blow that water in between the teeth. That's something that we do watch out for patients that have aspiration risk. We don't use the water pick in patients who need their liquids thickened. We can't forget the tongue. We want to make sure that our patients are brushing the tongue or using a tongue cleaner. I personally like tongue cleaners, and this is my favorite tongue cleaner. This is a tongue cleaner that's made by Elevate. The reason I like it is if you compare it to this one that I bought at the dollar store, then you can see that this one's a little wider and this one is a little more round. As you go to the base of the tongue, you can see this one goes off to the sides a little more. For patients that have a gag reflex, such as myself, it's a little less comfortable and may stimulate a little more gag reflex, where this one you can still get to the sides of the tongue by rotating, but you have a little more control of where you're going on the tongue versus the wider tongue cleaner. People sometimes ask, what is the best toothpaste? And I say the best toothpaste is the toothpaste that that patient will use. You want to take things into consideration, such as taste, such as texture, and sometimes it's going to take a lot of trial and error to find a toothpaste that that patient will like. But work with your dentist and find a toothpaste for that patient. We're going to have a toothpaste tasting station in our clinic, and that's going to help people be able to see what they like before they have to invest in an entire tube of it. But really, finding a toothpaste that person will use is important because we want brushing the teeth to be an enjoyable experience, not something that is forced. So far we've talked about assisted oral hygiene, which is physically helping someone carry out their oral hygiene regimen. We've talked about tools that you can use for assisted oral hygiene, or tools that can make hygiene a little easier for our patients. The next thing to talk about is guided oral hygiene. So guided oral hygiene is using teledentistry to help patients or to help caregivers with customized oral hygiene. It's basically like oral hygiene instructions, but live and right there with the patient, where you can see all of the oral hygiene that's going on. So you are virtually going to join that patient at home and help them with their oral hygiene. This came about because our assisted oral hygiene program was put to a halt when the pandemic came by. We had to stop going into the facilities because everyone was on lockdown. So what we did was we hired some caregivers to do the assisted oral hygiene. Well, those caregivers are not trained in oral hygiene, and they were very limited in contact. So we used guided oral hygiene using teledentistry with a trained hygienist and myself as well. And we trained those caregivers for every patient so we could continue providing those hands-on hygiene services utilizing teledentistry. This can also be used with a patient as you're coaching the patient, showing them where they missed a spot, and then talking about the tools that they can use to make sure that they clean their mouth properly. In the same group that came up with the definition for assisted oral hygiene, we came up with a definition of a guided oral hygiene, and here it is. Utilizing audio and video technology to guide a patient or caregiver as they carry out self-care oral hygiene on a regularly scheduled basis. Guided oral hygiene is patient-specific and does not apply to the use of generic pre-recorded oral hygiene instruction videos. Guided oral hygiene is a specific service and may be delivered separately or as part of a remote health support program. Guided oral hygiene can be represented by a combination of the CDT codes D1330, which is oral hygiene instructions, and D9995, which is synchronous teledentistry. So it's basically oral hygiene instructions over a synchronous teledental connection. One thing you're going to notice here is that guided oral hygiene and assisted oral hygiene have very similar workflows. We want to know their medical history so we can make appropriate recommendations. We want to know what their teeth look like in dental work that they have so that we can find out the areas where we think they're going to struggle so that they can have the appropriate tools to clean those difficult areas. We want to make sure that we have the entire dental team involved, where we have the dentist reading the history, the hygienist designing the plan, and then we're using that guided oral hygiene with either the hygienist or a very trained assisted oral hygiene assistant. They're going to be watching that caregiver, they're going to be teaching that caregiver, or they're going to be watching that patient and teaching that patient. and they're going to be doing that with a live video connection. So comparing those two, you have assisted oral hygiene where we're physically in there and we're physically helping them with the home hygiene. Then you have guided oral hygiene where we're using video communication to be able to help the caregiver or the patient improve their home oral hygiene skills. So when do we use each of these? Guided oral hygiene can be very, very useful in pandemic situations, but also I can see that being very useful in future situations of the flu. I think that guided oral hygiene can be used to monitor assisted oral hygiene programs, and guided oral hygiene also can be used in rural areas where it's really difficult to have somebody go out and provide assisted oral hygiene, or perhaps in a single-family home where it's difficult to have a dental team member go out and brush regularly. So there are a lot of uses for both guided oral hygiene and assisted oral hygiene, and I'm sure if you start doing programs like this, you're going to find your own creative uses for these as well. So the last thing to talk about is the Your Special Smiles Oral Hygiene Ability Spectrum. We developed this documentation system because we noticed that not all patients require the same amount of help when it comes to performing oral hygiene. Some people are what we call independent. So if you are independent within the spectrum, that means that you know your oral hygiene plan and you are able to carry that out on your own without reminders, without motivation. The second category we have are patients that fall under motivation needed. These are patients who are able to carry out their entire oral hygiene plan, but they might need somebody to remind them to floss, or they might need someone to remind them to do it. And so these are the patients where all you need to do is put a Post-it on their mirror, or all you need to do is stop by their room and say, hey, did you brush your teeth? Did you floss your teeth? That's motivation needed. The next level on the spectrum is we have limited assistance needed cooperative. This means that maybe that patient can brush but not floss. Maybe they can brush the right side but not the left side. So they can do part of their oral hygiene plan and they cooperate. They let you do it. The next level on the spectrum we have is limited assistance needed semi-cooperative. That means that sometimes they'll let you do it and sometimes they won't. Or maybe they'll let you brush but they won't let you floss. So they can do part on their own, but they need help with part. And sometimes they cooperate with that or they cooperate with only part. We have dependent cooperative. So the next level here is dependent cooperative. This means that they cannot do any of their oral hygiene for themselves, but they're going to let you do the entire thing and they're going to cooperate with you. So that is dependent cooperative. We have dependent semi-cooperative. What dependent semi-cooperative means is that they are dependent upon the caregiver to perform the oral hygiene, and sometimes they let you do it and sometimes they don't. Or they'll let you do part of it but won't let you do the whole thing. Lastly, on the spectrum, we have dependent and non-cooperative, or sometimes just non-cooperative in general. Someone who is not brushing their teeth, they either cannot or will not, and they won't let you do it either. And so a dependent non-cooperative patient is somebody that we're going to be trying things like desensitization. We're going to be trying to do little steps to help them have better oral health. We're also going to have to think of alternatives for better oral health. Things like limiting sugar intake and things of that nature. And so when we look at the Your Special Smiles Oral Hygiene Ability Spectrum, the purpose of this is documentation. You have a very different documentation from somebody who really you just need to check and make sure they have a toothbrush and toothpaste, versus we need a very structured plan for these patients who are non-cooperative and fully dependent for oral hygiene. We need to document everything that we've done to try and help them improve their oral hygiene. We use this as a color-coded system. As you noticed when these things were coming across, they all had colors associated with them. And that's when we're doing paper charting, we can use those colors and it just helps us. These categories are also very fluid. So a patient may be motivation needed, but then have their physical skills decline a little bit, and when that happens, they may now need a little bit of assistance. So they would move into limited assistance needed cooperative. They also might not be cooperative. And so you can jump back and forth between categories with these patients, but what this is they're different papers and different documentations for each of these patients, and it'll show effort as well as show success and failure. You're welcome to go and find these on our website to learn more about them. We could give a whole hour course on this, but what this is categorizing patients for the purpose of documentation, but also for the purpose of follow-up. So when a caregiver moves on to a different position and a new caregiver fills in, they'll be able to take a look at that patient and be able to see where they succeed and where they struggle with oral hygiene and be able to read the notes. But it's also not a cumbersome amount of notes because most of it is just check boxes. So go ahead and check those out on our website if that's something that you're interested in, and take a look at how we can document various abilities and promoting independence, because we always want to allow the patient or allow the resident as much independence as possible while still being able to have an adequate oral hygiene be provided. So in summary, we talked about assisted oral hygiene. We went through some oral hygiene tools. We talked about guided oral hygiene, and then we went through a documentation system that we use that helps provide continuity yet also promote independence by categorizing patients based on cooperation and ability. After going through all of that rapidly, I will now pull over and come on live so that I can answer any of the questions that you have, and I think we have about 3 or 4 minutes to do so.